Hello, everyone, and welcome from wherever you are to this virtual space with the University of Cincinnati College of Medicine. My name is Elsie Bearcat, and I'm here to tell you a little bit about our public health program in undergraduate College of Medicine studies. I'm going to share my screen with you and begin our presentation. All right. So my goal today is to share with you a little bit about the field of public health, a little bit about the program at University of Cincinnati, and what one can do with this degree when they are done. So what is the field of public health? The limelight has been on this field a little bit more the last few years, especially in a post-pandemic world. It's hard to imagine this not being a part of everyone's conversation, but what really is it? What does it mean? I think it's important to define it two different ways. One being that we take a look at health from the perspective of a community, whether that's a neighborhood, the state, the nation, or even the globe. It takes a look at health from the perspective of a community, what affects groups of individuals, different populations versus just a singular person. This also takes an upstream or preventative look at medicine. So if somebody were to show up today at the hospital presenting with cardiac symptoms, a doctor would be concerned with, treating the symptoms, of course, and, moving forward, addressing how this person would, want to, operate so that they could live a long, happy, healthy life. But preventative medicine would ask things like, what got this person here? What access to different types of healthy or fresh foods did they have? What was their home life like? Was their neighborhood safe for walking? Did they have health insurance? Did they have support keeping up with their doctor's visits? What were the reasons that led this person to the point that they are now? So public health or preventative medicine takes a look at those things. I myself transitioned from the field of public health into academia and college admissions recently after working in the field, and have found this to be the case in terms of prevention. There's addressing medical and preventative needs at the individual level, and there's a way to put this information out at a community level, and this is what this field is aiming to do. So what does a public health professional do per se? It's a person whose goal or aim is to improve the health of individuals and therefore the community. We want to increase or enhance quality of life, and ultimately make sure everyone lives a happy, healthy, and productive life, and that's reflected in the community. So a great example of this would be at the University of Cincinnati. We actually have a program started by a previous graduate called Be Well UC. It's an example of a corporate wellness program where it was designed to incentivize healthy behaviors amongst UC employees. And if we are to participate throughout the year, it's tracked, and at the end of the year, we would be incentivized by, giving us reimbursements on gym memberships or, points collected. And then again, like, different incentives one would collect at the end of the year. And go figure, these programs increase, employee satisfaction, happiness, productivity. And at the end of the day, a healthy, happy community is more productive. And these are all, goals that everybody can get behind. So this is just one example of a public health initiative or program started by an individual, and it happens to be close to home at UC. What's special about the public health degree at UC is the fact that it's interdisciplinary, which means that many colleges across our campus are coming together in order to be able to offer this degree. It is housed in the College of Medicine, but is a collaborative of most of our colleges, which means many world-renowned faculty at our campus are offering a plethora or just a huge wide variety of electives in order for a person to craft their experience to best fit their passions or what they're most interested in. So this is an exciting opportunity because it can all be located at one campus. This isn't something you find too many other places. The faculty means that they bring that experience and knowledge with them, and that means more opportunity to connect when it comes to our experiential learning, opportunities for research, opportunities to get out into the community. And at UC, we pride ourselves on providing all students experiential learning opportunities. And one of the biggest ways we do that in our program currently is to offer an internship that typically takes place at the end of one's degree in their last year. And I'll share a little bit more about that in just a moment. These are some potential working titles of those who have backgrounds in public health. You most commonly might see them called health educators, but you also might see folks work in disaster preparedness, like with the American Red Cross. We've seen a lot of folks in the infectious disease area over the last few years, hospital administrators, the list goes on. But of course, again, being from the field and speaking with my colleagues, we always knew that the money should have or could have been in preventative medicine, and the world is kind of waking up after or still in the midst of the global pandemic and realizing that this is a growing need to increase and to bring more people to the public health field. So while healthcare is growing over the next several years, particularly this field is also on the rise, and it's another reason why people are looking into it. Currently, we offer a concentration with our bachelor's program. It is in health promotion and education. This would best prepare someone to become a health educator, would be the working title, most likely that someone would have after completing this program and this concentration. And the unique thing is that with completing this coursework and that concentration, one at the end could sit for this test or this exam called the CHES exam to become a certified health education specialist. This means that a person went above and beyond and took this extra certification and can help set themselves apart when looking for jobs upon graduation. So this is a great opportunity because the coursework covers the material that would be on that exam. While it's not required, it is certainly recommended that people take advantage of that opportunity and add that credentialing to their resume. These are some examples of health promotion education courses, or the courses that are focused in that concentration. Things like Intro to Public Health. We've only scratched the surface today, so one needs a whole class to meet their future colleagues and speak with professors and get some intro lessons as to what's happening in public health. Intro to epidemiology. So how do we take statistics and use that to describe what's happening in public health? Emerging health issues. I wonder what they're talking about in that class. I'm sure the pandemic, amongst other things, I know when I was in school, we would get into a class like that and we would do nothing before we reported on the latest happening. So back then it was Ebola. We would do nothing until we talked about that for half an hour. And in this class, I'm sure that's what they're doing with current hot topics. And then in terms of electives, there's a huge opportunity to incorporate electives that one is most excited or most passionate about. And I could not even begin to list those for you. So these are just the categories in which you will find those electives. There's community health, where you can take classes about things like, the family unit, women's health. There's a class that centers around the HIV/AIDS epidemic. If someone's passionate about nutrition, they can spend more of their classes there. Race, equity, inclusion. So lots of classes that talk about the social determinants of health or other factors that we take a look at when it comes to health equity. So why is it that certain populations are experiencing certain health issues more, or certain communities are experiencing certain inequities more? You'll have an opportunity in those classes to dive more into that and look into the history of why that is. And if at the end of the day, in all of these classes, there's something you still can't find, or if you stumble across an opportunity that's just too good to pass up and needs to be a part of your educational background and transcript, the last option is an individualized study plan. So one can find something, craft that experience with a faculty member, and it would count towards their program as well. Just another wonderful opportunity. Towards the end of one's program, they would take part in an internship. This is not something that, one goes and just finds and does on their own. It's not just a summer thing. It is a part of their semester. It is a large part of usually their last semester. And being that we're in the middle of Cincinnati, a big booming city that's got a lot of industry, a lot of healthcare connections. We have already relationships with Tri-Health, American Heart Association, the Public Health Department, American Cancer Society, CDC, and of course, we're home to one of the best children's hospitals. So we have great opportunities for internship already, and of course, faculty to help find internship opportunities if there's something else that one is interested in. And maybe it doesn't exist yet, but there are certainly many, many opportunities that already exist at UC and in Cincinnati for this internship. And so what does one do after they graduate? A couple different options. Some people finish the degree and they can go on into the workforce. That's the exciting thing about the versatility of this program. It can be used to do many different things. So one can graduate and go on to work at a health department, at a hospital, at a nonprofit, wherever the case may be, working in health education. Or one could decide to stay. And if you stay, we hope you stay with us. One can go on to get their MPH or Master's in Public Health. Maybe do other graduate studies like social work, accelerated nursing program. And this can also be used or crafted in a way to prepare for different professional programs. Of course, working with an advisor in our pre-professional advising center as well, one can certainly make those things happen. So we have students who do wish to use this to go into, for instance, medical school. Just another unique way to do that. Some exciting things that are happening at UC with our students. I just wanted to highlight a few of those things. Number one is we do have a health program centered student organizations, one of those being Eta Sigma Gamma or ESG. This group typically gets the opportunity to plan, implement and evaluate campus wellness events. And currently, it might look a little bit different, with the changing scope of how the pandemic is affecting campus life, but they are still meeting, they are still hosting events through all of that. And they also connect to SOPHE, or the Society for Public Health Education, which is a great networking opportunity for students. It's never too early to start. Great for resume building, great for beginning the job search. It's always more advantageous to start during school as well, because different ways to join and different ways to connect to those who are out in the field already, and discounted rates to conferences and so on and so forth. We had a couple of students in past years here be a part of our community health needs assessment for Cincinnati, which is a really unique opportunity. I usually don't see this until folks are in the master's program level. So that they had this opportunity to sit at a table per se with many stakeholders in the community and set the priorities, the health priorities for the city of Cincinnati, which is a wonderful and unique opportunity. Usually their names will get published along with this. It's a great opportunity that one could experience in undergrad and connect to folks in the community, different stakeholders. And lastly, just a quick student spotlight. A student had the opportunity, her name's Olivia, to travel right before the pandemic to Uganda, and had the opportunity to do a medical shadowing a travel experience. And she says that she hopes to be able to repeat this experience when traveling is available again. So this public health student in particular wishes to use their degree to go on to medical school when they're done. All right, so what do we do now if we want to apply or if we're interested? We are a Common App school, which means when you complete the Common application, you can check University of Cincinnati, and you are applying to come here. Choose your areas of interest. If one of those is public health, put us on the top. and so on and so forth. When you are reviewed for admittance into the university, you're reviewed to be admitted to your top selected program first, and then so on and so forth. We are test optional for next year. So that means if you take the ACT or SAT and you do pretty well, go ahead and turn in the scores. But if you don't have the opportunity to take the test, or if you don't test too well, this is not a make or break situation. Don't submit the score, or if you can't take the test, that's okay too. And we'll take a look at the entire application when reviewing, and make sure we take a holistic look at your background and your experience. So the letter of recommendation will be needed. And when taking the time to fill out the application, make sure you include everything you've done over the last several years: working, volunteering, any interests. Certainly complete the FAFSA, which is now open to be so you can be considered for scholarship and financial aid. And if you do all those things by December 1st, you're considered in by the early action date. What does that mean? It's a non-binding way for saying you would like to, you're considering or would like to come to UC. And by applying by December 1st, you are going to be first reviewed for scholarship and financial aid. You can apply in the future afterwards, but the consideration for scholarship and financial aid are not necessarily there. So that's why we recommend doing it by December 1st. It's non-binding, which means if you decide, this is not saying I will come to Cincinnati, it's saying I would like to come to UC. So also it is non-binding. If you have any questions about the application, FAFSA, the program, or anything else that I can share more about, my contact info is on this last slide here. I encourage you to give me a call, send me an email. I would love to talk more about the program, about UC, about anything that's on your mind. I appreciate, let me stop share. I appreciate you joining us from wherever you've been. Again, reach out if you have any questions or need anything from me, and I wish you the best of luck in this next year as you complete your application process and, move on to the next exciting thing in your life. Again, my name is Elsie Bearcat. If you need anything else, let me know. Best wishes, and everybody take care.